So is depression degenerative, or can ketamine, I don't know, can it cure depression? Can it just slow? What does it do over long periods of time?
And so there is degenerative pieces of it. And so on brain scan, we can see that areas of the brain, like the hippocampus in particular, become less active over time in people with depression. For me to say that there's this particular cause, and this is the unfortunate thing that we don't really understand at all, but we're really starting to treat what we once labeled mental health, or mental illness. We're starting to say, are these things that somebody's experienced, the anxiety or the depression, that people are experiencing, those types of symptoms that we label, is there something underlying that's going on? And we have known for a long time that the certain areas of the brain become underactive in people who experience certain types of symptoms. And so are we curing depression, or is depression a signal to us that says, hey, this area of the brain may not be functioning as well as it should be? And part of that goes into the idea when we think about ketamine for a traumatic brain injury is that we know that we can spike the dendritic growth and, we can protect the brain against some of the things that cause damage to it in increasing the growth factors and kind of asking the brain to work around the areas that have been damaged. And similar to like in a person who has a stroke that goes to PT to learn how to walk again or to talk again. It's a long, painful process, but what we're doing is retraining the brain to work around an area that may have been massively damaged. And so when we think about ketamine, we think of it more as a neuroprotective agent that actually protects the cells of the brain from injury and premature death that can often come, with injuries, or if there's an excessive flooding of those things like norepinephrine, adrenaline, and the other things that we associate with trauma and with injury and long-term stress, is that if we're able to heal these areas that are less active, the symptoms that we associate with it, like the depressive symptoms, slowed thinking, lack of energy, whatever you might call it, is actually an indication that something's going wrong. Similar to kind of how we think about chest pain, right? If somebody comes in and says, I have chest pain, we don't say, oh, let me give you some pain medicine for that. We can probably make that chest pain go away. We say, oh, what's going on with that? Is there a clot in the heart? Is there, is it not pumping right? Is there some, like the oxygen isn't flowing from the lungs? We look at all these different things that could be going on with the heart, and we think of heart like chest pain as a signal that something's going wrong. But we've never done that with these mental health symptoms. We've called the symptoms the problem versus looking at what it is that's causing those symptoms. And so the fact that we make this distinction between mental health and physical health, how is the brain and the nervous system not part of the rest of the body, right? And in fact, I would argue it's probably the two biggest systems in the body, right?
Like Dr. Daniel Amen says, the brain is the only organ that is studied but never looked at.
Right. And so we've always jumped to the symptoms are an illness, and we don't do that in any other part of the body. We don't say chest pain is the illness. We say, oh gosh, chest pain means that something's going wrong. Like, we don't generally have chest pain. We don't generally have anxiety, and not everybody has depressive symptoms. And so when we look at it, we've been looking at it kind of backwards. And do I believe that every symptom that we have has an underlying treatable cause? Probably. Do we know what it is for many of them? Not just yet. But I would argue that we have to start looking at, when we're talking to patients, we frequently use the idea that if somebody comes in with a broken leg, right, and the bone is clearly broken, we don't send them to rehab and say, let's start strengthening the muscles and things like that. Here's some pain medicine, without first reconnecting the bone, letting it heal, and getting back into a stable spot before we go to rehab, right? So that would be the therapy and stuff. Huge proponent of therapy. And, I still prescribe many medications, and I doubt that we're ever going to fully get away from medications, at least not in my lifetime. Medications do really serve a positive purpose, but we've overused them and have used them thinking that they're the curative agent. And instead, we're using them to manage symptoms that a lot of times, that if we look at the underlying cause, if we can eliminate that, or if we can boost the brain health and the brain growth, or decrease the sympathetic nervous system response to stimuli, all of those symptoms suddenly go away. And so it's a huge shift, and something I've always believed in, and what's what's the source of trauma? And I think that word maybe gets overused a little bit in the idea of like, we talk about, oh, it's just trauma, but understanding what does trauma mean in the idea that, are we talking about a physical trauma, like to the brain, like maybe, concussive injuries, or, we treat a lot of first responders as well as really treat the folks who've been in the military, like the special operators and stuff who've been in concussive blasts and close quarters. So it doesn't have to be a direct injury, like as far as a hit or something, but they're jumping from planes. And so the brain's rattling around. What does that do over time? And how does that change how we think and behave? And so is the jumping and the close concussive blasts that change our personality, that's a traumatic brain injury. But when somebody talks about PTSD, we focus on their anxiety and their depression. Well, the anxiety and depression are coming from those injuries to the brain.